So I've got the lovely Juliet here today. She works with us as a persona and she's due to have her Botox done. It's not completely worn off, but I've got all her notes so I know what we do, and she just likes to maintain it. So it's just going to be a little bit in the frown area. We're going to do a bit in the forehead because we give her a nice little brow lift, and then a little bit around the eyes for her. You frown for me, honey? Yeah, I mean, you can see it's not... And relaxed, darling? Yeah, it's not worn off at all, but it's worn off. It's wearing off, but not completely. So, but I always repeat the same dose because we know that that is what works for her. So we're going to just do injections into the procerus and the corrugator supercilii muscles, which are the ones that cause you to frown, hence develops the little lines. Okay, and lift up your eyebrows for me. Yeah, I'm just going to inject a tiny bit here into the frontalis muscle purely because there's a little bit of movement coming back, and what we do is, in order to get the brows to lift, if we relax the central part of the muscle, the lateral part of the muscle will overcompensate and create a nice little lift for us. Okay. So with Juliet, you can see the crow's feet coming down slightly. So I do what I call a double row, so we can catch these crow's feet also that are coming further down. And again, because I've treated Juliet in the past and we keep records for all of our patients, I know what works for her. And if we know what works, we just do the same thing again. Smile again. Yeah, I'm just going to do a little bit just on these ones that are coming down here as well. Can't go too far down the cheek with Botox because you start affecting the muscles of the lower face, which can affect the mouth, the movement, etc, etc. So you have to really know what you're doing and your anatomy when you're dealing with toxin generally, but particularly when you're doing advanced treatments. And just a little bit here. Voila. Unfortunately, Juliet is prone to bruising, and whenever I do treatment on her, she always ends up with a little bruise, but we've got some great anti-bruise cream, so she'll be using that to get rid of it.